Grab a little Sunday gravy tonight, huh? Mom will show you. I'm 39 years old. I've been married to Michelle, who's my best friend, for the last 17 years. And we have 3 wonderful children. My family really is the most important thing to me in my life. During the summer of 2009, when I was doing a lot of bike riding, trying to get myself back in cardiovascular shape, I noticed that my left leg seemed like it felt weaker, fatigued. It wasn't keeping up with my right leg. Simultaneously, I noticed that my breathing seemed to be impacted as well. After numerous tests, seeing several different doctors, I received 100% confirmation that the disease was ALS.
Amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, is a slow degeneration of the large nerve cells that exist in the brain and the spinal cord. So over time, patients experience weakness of their limbs and eventually experience difficulty speaking, swallowing, and breathing. From diagnosis to death is approximately 36 months. What we have shown in our research in our laboratory is if you take stem cells and place them into a diseased spinal cord, the large nerve cells, which would usually undergo degeneration with ALS, those actually large nerve cells will begin to look healthier. In fact, the stem cells surround the sick appearing nerve cells and nurse those nerve cells back to health. What that could mean for a patient, we hope, is that if the large nerve cells in ALS do not degenerate as rapidly, that patient could have preserved strength and preserved function. When we decided at the Taubman Institute to begin the stem cell trial, we did it in collaboration with the biotech company Neuralstem. And in discussions with Neuralstem, I told them that we really truly needed the very best neurosurgeon in the country, because this was going to be the first time that anyone had tried cellular therapies in ALS, and it was going to set the stage for all future trials. So that was when I knew I needed to go to Dr. Nicholas Boulos. Nick had done his neurosurgery residency here at the University of Michigan, and I had had the pleasure of him being my fellow for 3 years in the laboratory.
I tell everybody that Eva raised me from a pup, showed me how to run a scientific team. It's been an extremely fertile collaboration. There are things that exist at the University of Michigan that don't exist here. There are areas that are extremely complementary. There are things that exist at Emory that don't exist there.
And as Nick practices at Emory, that began the natural collaboration between the University of Michigan and Emory.
2 weeks prior to surgery, I had been shown a lot of deterioration. 2 weeks post-surgery, everyone, including myself and the doctors, were amazed. 4 weeks after the surgery, there was even more improvement, and we were all shocked and flabbergasted. They even re-diagnosed me to ensure they hadn't made a mistake. An ALS diagnosis 100% came back. Ready? Go, 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 go. So now here we are, nearly 9 months after the surgery. I no longer use a cane. I no longer struggle going up steps. Well, certainly I still have weakness in my left leg and my left arm. I feel like a brand new person, and I feel like, honestly, the clock has been set back 18 to 24 months when I first started having symptoms.
I really feel like our work in this laboratory, in this collaboration, has forged a new path and opened the door to any kind of therapy where the most expedient way to bring it to humans is spinal cord surgery.
As we complete our phase 1 safety trial, our next step will be to do a much larger trial to see if indeed the cellular therapies show a true treatment effect.
The time is now because of the enormity of what we can accomplish in the next 10 years. But without our collaboration, it's not going to be 10 years, it's going to be 30 years or 35 years. And we'll be lucky if we get across the finish line.
I know I have ALS, but I hope and pray that if they continue this research and they continue understanding how I've been helped and how they can advance the research to help others, that maybe I can be helped again. I definitely have dreams that this will last, that this will enable me to do all the things I wanted to do, be there for the high school graduations, attend all the milestones, like weddings and grandchildren. My number one dream is that the ALS community can all benefit. Certainly this is not a cure, and I don't want to spread false hope, but I want people to know, thanks to all this research, it's okay to have some hope.